Okay, I think we'll get started because again, we have a lot to cover and we want to definitely make sure we have time for Q&A at the end. So good afternoon, everyone. Thank you for joining us today. My name is Maritza Crossan. I'm the Chief Operating Officer here at CHAPA, and I'm delighted to welcome you to today's webinar and to the first research release from CHAPA's Housing Policy Action Center, focused on federal housing choice vouchers. Housing choice vouchers have a nearly 50-year legacy of supporting housing access and stability for households with the lowest incomes. At a time when this program faces increasing threats, it's critical that our policy and advocacy efforts are informed by strong and current data. Today, we're excited to share new, first-of-its-kind research from NYU's Furman Center, examining statewide and regional patterns in housing choice voucher use across Massachusetts. This research is actually especially meaningful to me in a personal level. As a child, my family was able to maintain stable housing because of a voucher. Having access to a housing voucher allowed my single mother to move from a city where she had little support to the town where she grew up. That move had an enormous impact on our lives. It provided us with stable housing and allowed my mother to work more consistently because my grandmother, who lived nearby, could help with dependable childcare. That stability mattered. It shaped my childhood, my sense of security, and ultimately led to my path in housing and policy work. I've seen firsthand how essential these vouchers are, not just as a housing subsidy, but as a foundation that allows individuals and families to build stability and opportunity. With that, I'm pleased to turn things over to Jennifer Gilbert, the Musicant Cohen Executive Director of CHAPA's Housing Policy Action Center, to kick us off. Thank you for all being here today.
Thank you, Maritza, and thank you to everyone for being here today. We wanted to lead with that wonderful story from Maritza. I'm so glad she shared it, and do that because what we're going to do today is cover a lot of numbers, really about an incredibly important foundational support for housing in our state and nationally. And so we're going to be going over things that are percentages and large numbers and dollar figures. But it's really important to remember that while all of those can help us shape action and think about how to respond to change, it's built up of stories very much like you just heard from Maritza, individuals who have the support to have stable housing. So leading off with that felt like very much the right thing to do. And with that, I am going to go on into our program for today. Next slide. So as you heard, housing choice vouchers have a 50-year legacy. They are an older housing assistance program. And in the last year in particular, there has been quite a lot of potential change around them. And I was really reflecting on this, that a year ago, there were discussions of things like maybe a 50% funding cut. Over the last year, there have also been media reports about potential program changes, things like work requirements or time limits. And all of these have gone back and forth, not necessarily been enacted. The overall theme, though, is there's been a lot of change proposed, a lot of potential changes that may be coming. And when we were thinking about what to present today about housing choice vouchers, what we realized is that grounding any response to any of those things in real numbers and data would be essential to really coming up with solutions and thinking through how to respond, particularly given how many households are impacted by any changes with this program. So with that, our agenda today is I'm going to do a little bit more context setting. We will then have findings from the team from NYU. We'll come back for some updates and a little bit about what's next. And at the end, we hope to have at least 10 minutes for your questions. Please enter those in the Q&A feature as you have them. We'll be scanning it throughout the webinar, and we'll hope to get to as many as we can. I'll return to that when it's time for Q&A. Next slide, please. So just to give you a little bit of background, this is, as Maritza said, the first release for CHAPA's new Housing Policy Action Center. The idea very much is to use CHAPA's place, which is as an almost 60-year-old convener and connector in the Massachusetts housing ecosystem, as a place to discuss and think about housing challenges. The center itself is focused on asking questions that matter and delivering rigorous research to provide answers to those and to prompt thinking. I'm so pleased that so many people showed up for this webinar. As you heard, there were over 600 people registered. I feel like that really confirms that we're asking questions that really matter for practitioners, and that's the goal. And I really can't think of anyone or any two people better to deliver rigorous research on the topic than our partners from NYU who will be presenting. So next slide. We are working with NYU's Furman Center. The Furman Center advances research and debate on housing, neighborhoods, and urban policy. Next slide, please. Our presenters today are Professor Ingrid Gould-Ellen and Professor Kathy O'Regan. I'm going to be turning things over to them in just a moment. But besides their national reputation on housing research generally, for both, housing choice vouchers has been a particular focus of their studies over the years. I also want to be sure to thank Jacob Haas, who's a doctoral fellow at NYU and provided much of the analysis that you'll be seeing with a lot of care to the details that make sure that this is reliable information. So next slide, please. A little bit more context, particularly for Massachusetts. Housing choice vouchers, commonly called Section 8s, are a key tool for affordability and stability. And as many of you know, that's because they help with deep affordability. They lower the resident paid rent to about 30% of the household's actual income. Nationally, it's the largest rental assistance program. It's almost 2.6 million households. In our state, and this was one of the first findings that I personally found really remarkable, 1 in 11 Massachusetts renter households relies on a housing choice voucher. And that's many more people would actually be eligible for it. But right now, there are 1 in 11 renter households finding a home, keeping a roof over their head using a housing choice voucher. It is, and this is the little chart that's on the right there, quite large as a program in terms of comparisons to our public housing stock. Our state and federal public housing combined is about 71,000 units. And we are one of the few states that has a state rental voucher program, MRVP, that's around 12,000 units. But as you can see, housing choice vouchers are almost 10 times the size of MRVP. So a huge factor in providing deep affordability, a really important piece of our housing ecosystem. We're going to be looking at the just over 98,000 Massachusetts program participants who were in the program as of December 2024. That's when the last HUD data was available for the folks at NYU. Today, there are more like 92,000 households in the program, but it does fluctuate up and down. Next slide. I wanted to give just a few highlights because again, we are going to be delivering quite a lot of pretty, I think fascinating and impactful findings, but these were the things that stood out right away. The scale is large, you already know that, and the reach is really quite broad. A voucher or someone is living in 318 of our Commonwealth's 351 communities using a voucher. So really broad spread all across the state. You'll see more about that. There is a wide variety of households. How could there not be? This is almost 100,000 households. Most voucher holders, though, are very vulnerable populations, high degree of people with disabilities, older adults, and 33% of households have children. The program supports affordability very much primarily for very low income households. It's a key safety net support. You'll be seeing some more figures about just how much the affordability gap is, and that'll be explained by the NYU team, but it ends up being about $59,000 a year for the state as a whole, and that is basically 2 minimum wage jobs. And finally, the length of time on the program is longer than national trends. We are a high-cost state, and I think many of the things that you'll be hearing about and seeing That's a factor in why the numbers are what they are. So next slide. Finally, just a few definitions, regions, so forth to help you as we plunge into this. As folks may know, housing choice vouchers are both mobile tenant-based vouchers. So those are ones that a tenant can use to rent in the Commonwealth, really anywhere or even nationally, as well as project-based vouchers. This is a different thing where the voucher is assigned to a building, so it really doesn't move. And a tenant in the building, in the unit that has the project-based voucher, has the benefit of the subsidy. We will be talking about both together sometimes as housing choice vouchers, and when the findings are separate to one or the other, that'll be clear. And then finally, we wanted to not just look statewide, even though that's an important uh, way, an important lens, but also to look at 4 geographic regions. These will cover City of Boston, Greater Boston, and you can see the counties that are included, Central Massachusetts and the Cape, again, the counties included, and then Western Massachusetts, that is the 4 counties there. So some definitions just to get you started. And next slide. With that, I'm going to turn it over to Kathy and Ingrid to go through the findings.
Terrific. Thank you, Jennifer. And I'm going to start and then pass it on to Kathy. So the first question that we asked was, who uses vouchers in the state of Massachusetts? And if you could go to the next slide, the and Jennifer highlighted some of this, but the majority of voucher households across the state are headed by older adults or persons with disabilities. And you can see that on the right, and you can see that the sort of the shares of those who are elderly and disabled are pretty similar in Massachusetts as they are across the country. 3/4 also, you don't see this on the chart, but 3/4 of voucher households in Massachusetts are headed by a female, and this is also similar to the national share. And again, as Jennifer mentioned, children, about 1/3 of voucher households across the state have children, which again is similar to the national shares. And if you can go to the next slide, you can see that the share of, you can see that sort of across the state in all 4 of the regions, majority of voucher recipients are elderly or disabled. That share is somewhat lower in the city of Boston, though, than it is elsewhere in the state. But still, again, even in the city of Boston, a majority of voucher recipients are either elderly or disabled. And if you can go to the next slide, looking beyond demographics, the incomes of housing choice voucher holders are extremely low in the state, especially when compared to the state's very high rents, and that makes it enormously difficult for voucher holders, sort of absent a voucher for these households to find stable, affordable housing. And what we estimated is, as we looked at the income, basically, that a household would require in order to afford the median rent in their region. And then we measured the gap between what voucher holders, the typical voucher holders earn and what that income would be, how much more income they would need to earn in order to afford the median rent in their region. And across the state, that average, the typical voucher holder faces would need an added over $59,000 in additional income in order to afford the median rental in their region, which is just kind of astounding. And if you look at the next slide, you can see that there's sort of these gaps are large throughout the state. Okay, in all of the 4 regions. They're not surprisingly, they are especially large in the city of Boston and Greater Boston. If you look at the gap in the city of in the city of Boston, the typical voucher holder would need to earn an additional $72,000, almost $72,000 in income, additional income, in order to afford the median rental in the city of Boston. And so obviously, these vouchers are providing a critical source of enabling them to find, secure, and keep stable, affordable housing. Um, and if you can go, and actually, let me, before going to the next slide, I do want to point out that sort of even in the Western region of the state, that you still see significant income gaps where the median voucher holder in Western Mass would need to earn about another $34,000 in order to afford the median rental unit in that region. So huge gaps in income. And if you can go to the next slide, the next question that we explored was, where do voucher holders live across the state? And you can see on this next slide that, as Jennifer already mentioned, that voucher holders live throughout the state of Massachusetts. So as she said, there was at least one person, at least one household using a voucher in 318 of the state's 351 municipalities. So vouchers are used and relied upon in jurisdictions throughout the state. Um, we also think, it's particularly important, we think, to sort of look at the locations reached by mobile vouchers, these which represent 81% of the total vouchers in the state. So in Massachusetts, 81% of the housing choice vouchers are mobile. They're tenant-based. Tenants can use them, wherever they wish to, and 19% are project-based, so they're attached to a particular unit. So if you can go to the next slide. Um, Again, mobile voucher holders can use their voucher anywhere across the state. They actually can even use them nationally, outside of Massachusetts. That's extremely rare. Um, and, a perhaps surprising finding here, this shows the distribution of voucher recipients throughout the four regions of the state, that only 18% of the total voucher holders, mobile voucher holders in the state, um, live in the city of Boston. Another almost 50% live in Greater Boston, with 18% on Central Mass and the Cape, and 15% in Western Mass. And this actually roughly corresponds to the overall distribution of the population in the state. And if you can go to the next slide, another key question, right, is what neighborhoods housing choice voucher holders live in. And, one of the key justifications for the voucher program overall, right, it's called the Housing Choice Voucher Program, is really about enabling and increasing choice for voucher holders, and opening up a broader set of homes and neighborhoods for low-income households. And so a common metrics that's used for sort of understanding these sort of locational outcomes is the degree to which voucher holders are living in high poverty neighborhoods. And you can see here that sort of across the state, the average voucher holder lives in a neighborhood with a 17% poverty rate. Okay, and you can see sort of across the state, actually, somewhat surprising to me, the voucher recipients in Western Mass, on average, live in the highest poverty tracts, live on average and when I say tracts, that's census tracts. Sorry, that's a sort of proxy for a neighborhood. It's about the size of a neighborhood. Live in a neighborhood with a 26% poverty rate. And if you can, and this is about equivalent, sorry, the state of Massachusetts, that's about on par to what the national overall average is of the poverty rates of the neighborhoods where voucher holders live across the country. And if you can go to the next slide, we also wanted to look at the neighborhood, the poverty rates of the neighborhoods where mobile voucher holders live, as compared to households receiving using project-based vouchers. And you can see that sort of in general, the mobile voucher holders live in somewhat lower poverty neighborhoods than project-based voucher holders, and that's especially true in Boston, where on average, the average mobile voucher holder lives in a neighborhood with 20% that's 20% poor. And the average household using a project-based voucher lives in a neighborhood or a census tract where the poverty rate is 27%. Um, and if you can skip to the next slide, the final question, well, the final question on the locational outcomes that we explored was the extent to which housing choice voucher holders live in subsidized buildings like LIHTC buildings. And and we estimate that at least, I should say, we think this is sort of a lower bound, but that at least 19% of mobile voucher holders live in subsidized buildings that are otherwise that are subsidized, like I said, like LIHTC buildings. And if we flip the question, we also can found that basically a full quarter of subsidized units across the state that they don't have project-based rental assistance attached to them, but they are a quarter of those units are occupied by a mobile voucher holder. So there's obviously, voucher recipients rely to a great degree on our subsidized housing stock in order to find affordable homes. So I am going to pass it to Kathy now.
Terrific. And next slide. Thank you, Ingrid. So I'm going to pick up on a series of additional questions we asked. And so our next section is focusing on two aspects of voucher use that get a lot of attention. And Jennifer alluded to this, which is how long voucher households remain on the program and what share of them are working. So next slide. And so we're digging into these aspects of the program because two common questions asked are about the length of time and whether voucher households work. And these questions are important in their own right, just connecting back to what Jennifer said about a point of this whole webinar, which is we want to add some facts to public discourse. So in the policy conversations, we actually know sort of what the right numbers are. And our second reason is because of the current policy questions and discussions that Jennifer alluded to. There's been a lot in the last year and a half. Early in this Trump administration, there was a proposed budget that had some changes that were related to work requirements and time limits. And so it's helpful to be able to do a cut of the data that gives you all a sense of how what the populations that could potentially be affected look like in your state. I'm going to say this caveat here. I'm going to say it several more times. Nothing has been formally proposed or adopted at this time. This isn't about actual policy changes, but this is a chance to take a lens into how features of the voucher population in Massachusetts matter among that conversation. So next slide. So let's start with time in the program. So what we've done here is we've broken out voucher households in Massachusetts on the left and a national comparison on the right into 4 time lengths. So down at the bottom of the slide, we've got the share of voucher households that have been in the program less than 2 years, and all the way up to the top are those who've been there the longest, those who've been in the program 10 years or longer. So probably the most important takeaway from this is voucher households remain in the program longer when they're in Massachusetts. So the median time on program is 9.5 years in Massachusetts, and that compares to 6.5 years nationally. A full 45% of voucher households in Massachusetts have been in the program 10 years or longer. So we're going to go back to the previous. Perfect. We're going to stay here for a second. I've got 2 more things to say. And so one thing this may not surprise anybody on the webinar because Massachusetts is a high-cost state, which will affect the ability of voucher households to leave the program. But also remember what Ingrid and Jennifer pointed out. The voucher program in Massachusetts disproportionately serves elderly and disabled households, and those two are populations that are likely to remain in the program for a longer time. So we've probably got both of those channels at work in this outcome. Perfect. One other thing I'll say is, and Jennifer alluded to this, when we look at other very high-cost markets, you see similar patterns. In New York City, median time in unit in the program is about twice the national average. And we have seen over the last decade that these numbers are increasing. Time on program is increasing across the nation as housing markets have gotten tighter. Okay, now next slide. We're looking this now at looking at similar analysis across the state, and we do see some variation in patterns. And I think you might be able to discern that housing market tightness and composition of the voucher population probably are both in play. But overall, key takeaway is that the median voucher holder in any of these regions has been in the program more than 5 years. Next slide. So the second thing we want to take a look at is considering work status. And in order to do that, we need to first take a step back and consider for which households is working status of interest in a policy sphere, right? Which households would even be considered work able, which is a term that's used in social and housing policy, particularly in discussions of work requirements. So for example, if we take the first group in the slide, households in which all adults are either seniors, so they're 62 years or older, or are disabled, are households in which we wouldn't have an expectation that somebody is working. It's not clear it's feasible for any of these adults to be working. And these have been, in the policy discourse, households with only seniors or disabled adults have been called non-work able, meaning there's not a working age adult who's not disabled in the household. And so we wouldn't expect anyone in the household to be working. And we're going to use that same definition here. So the second group is households that contain at least one non-senior adult who we can either clearly see is not disabled, or if we can't see whether they're disabled, we can see that they're working. And if they're working, that suggests that that adult is work able. So these are households that have at least one adult who appears work able, and we're calling that household work able. And then we have a small remainder category that contains, these are households that contain a non-senior, non-working adult whose work, we can't see their disability status, so we don't know whether there's somebody in the household who is considered work able. So I'm going to use those categories. Next slide. And I'll take this first category, I'll use this category here to then take another to describe work able households in Massachusetts and the US. And we can see here that in Massachusetts, the majority of voucher households, about half, are not work able. So that's on the left, that's the blue or teal portion of the graph. You can see that's slightly higher than the national average, which probably aligns with having a greater share of households headed by seniors or those who are disabled. Next slide. And of those who are work able, so now both bars on the graph are purely looking at those households with vouchers who are work able. We can see that 2/3 of the work able households in Massachusetts have at least one adult who's already working. Right? So they're something that can frequently not be known in the public discourse is the high rate of working among voucher households in which there is at least one work able adult. Next slide. And then the last piece on these work able households, the majority of work able households contain children. So in Massachusetts, more than 60% of work-able households contain minor children. And so as we have conversations about work requirements, those are focused on work-able households, and most work-able households also include children. Next slide. Perfect. And so what we're going to look at in this last set of figures is doing some cuts on the data that connect directly to the two policy realms that Jennifer raised earlier, which is the conversations about potential time limits and conversations about work requirements. And the idea is to cut the data in a way that would help you get a sense of the populations who were at least potentially affected throughout the state of Massachusetts. Again, this is my second time on the caveat. Completely as of yet, hypothetical policy changes. We don't know if there are going to be policy changes in this area, but it's helpful to have a sense of what the magnitude of the populations are that are could be part of the conversation. So next slide. So most discussions about time limits and those that were proposed earlier in the Trump administration in the federal budget would only be applied to work-able households. Non-work-able households are generally exempted both from discussions on time limits and from discussions on work requirements. So what we're doing here in this slide is assessing the time on the program specifically for work-able households, because those would be the households who might be part of any of the policy changes. And so here, what do we see? Even among work-able households, voucher holders in Massachusetts have been in the program longer than the national average, right? So looking on the left, we can see that 82% of work-able households in Massachusetts have been on the program 2 years or more, and 40% of them have been on the program more than 10 years. My real takeaway from this slide, since we don't know whether there will be any particular type of work requirements, is that any version of time limits, any version of time limits would disproportionately affect Massachusetts, even recognizing this is the work-able population. So this is not because this is taking the seniors and disabled out. Next slide. We took another cut at this to look at how this varied across regions. And we do see some variation. And I think here it might align with the regional cost numbers that Ingrid was looking at. We see that time in the program is shorter in Central Mass and particularly Western Mass, where the costs of housing differed. But what struck me in looking at this is that in every region would be more impacted than the national numbers show. So said another way, every region among work-able households have been in the program longer in Massachusetts, in each of its regions, than we see nationally. Next slide. And this is the last cut we're going to be doing and the last figure among all the numbers. And this is to connect back to any potential work requirements. And what we're doing here is showing the geographic variation among work-able households. And we can see that while in 3 of the regions, the majority of households, let me get this right. So the majority of households are not work able. So the lightest blue on the bar, we can see more than half or more of voucher households in 3 of the regions are not work able. That is not true in Boston, right? Ingrid pointed out some of the differences in the population served in Boston. In Boston, most voucher households are work able. So to the extent that there are any type of work requirements, most of the voucher households in Boston are potentially affected. And again, most of those households have kids. We thought the geographic variation in this was of interest, but we are particularly interested in hearing from you all on what you find interesting in these numbers. So I'm going to hand it back over to you, Jennifer, now for some summary.
Great. So thank you. Thank you both. There was so much in there. I know everyone agrees and explained very well. We've gotten some great questions, so I'm going to kind of move rapidly to get to that. But next slide. Just so you all know, I wanted to give a little bit of updates. We did not expect to have breaking news, but yesterday Congress passed the HUD budget. You will doubtlessly be hearing much more about what was in it. In terms of the Housing Choice Voucher Program, there was an increase from the last fiscal year. So that is in and of itself something positive. I think the ramifications aren't yet known for some major things more at the local level in terms of the ability for some housing authorities to start issuing vouchers again, things like that. But some news. There is also some proposed legislation that includes some measures that might streamline the process. This is more on the landlord and inspection side, not so much what we focused on today, but didn't want to not mention those things. Again, I think the big takeaway is that there is a lot in this program, and things are often changing about it. And you know, that's not a bad thing. It's a 50-year-old program. We hope, again, that some of the information that we provided can be of use as we kind of work through what all of these things will mean. So next slide. To let you know what's coming from the center, we got questions on this almost right away, and I should have said so in the Q&A. We will be making the slides available. There is also a report that summarizes a lot of what we talked about, as well as provide some additional context. So those will both be up on the CHAPA website, the Housing Policy Action Center's subpage. Should be up this afternoon or tomorrow. Please go back and look. Another really important thing is that, as mentioned before, we did not include the MRVP program in our findings. That's the state's rental voucher program. It's really a whole nother data set. It's a whole lot of different things, but both of these things are rental assistance, both the federal housing choice vouchers and our own state program. Cookie Day is the annual day that is about the legislature and making sure people know how impactful the program is, the MRVP program. So definitely invite you all to think about how to be part of that if you're able. We're going to be doing some other things to activate this research in terms of convening some smaller groups in person and sharing this. For sure, whenever you do research like this and you ask a lot of questions, it causes you to have even more questions. And we are thinking about whether we want to do sort of another phase of research on housing choice vouchers, given the interest and how important they are. And also given, I think, unfortunately, a lot of stereotypes and stigmas about the people who rely on the program, as well as just some, misperceptions about how it really works at the ground level. Hopefully today helped address some of those, but we're looking for things that might do more or might do it around MRVP. And I will say that lots of things in the questions sort of speak to those kinds of places that we might be thinking about for further research. So next slide, please. So questions, many of you have already started asking questions, but you do have time to get some more in, and I really appreciate anyone doing them. We doubtlessly will not have time for all of the questions. However, it really helps us know what people are interested in, what we might focus on if we were to do more research, and very much what is helpful for practitioners. A couple of things just to clarify before I start asking some of the questions. The data covers only housing choice vouchers, federal housing choice vouchers. The data did not include MRVP, PBRA, public housing. We've got a bunch of questions about that. So just to make clear for everybody. And when we looked at the world, the slide that was about 25% of subsidized units have someone using a voucher in them. We used for the universe of subsidized units, just to clarify for people who kind of know the nitty gritty of this, really, as far as we could, everything. So tax credits, 40B properties, inclusionary addresses that we had. As Ingrid and Kathy pointed out, there were some limitations that we just don't have property address data for every single building and unit. However, we really did our best in doing those numbers. Hopefully they at least tell you the floor of what it might be. So now I think I'm going to go to questions. The very first question we're going to lead off with was one we got right before the webinar. Someone sent it in. So this is definitely for Ingrid or Kathy. You all can decide. Is there any research that sheds light on the experience of people with disabilities in terms of limiting their housing options when using the Housing Choice Voucher Program? And really, are they able to use vouchers in comparable ways to people who do not have disabilities?
I'm happy to take that one. And thank you both for the question and sending it in advance, because it made us look back at some work we did more than a year ago. So the simple answer would be just looking at what we would call success rates, the ability to use the voucher at all. And nationally, if you look at success rates for voucher households and compare it to voucher households where the head is reported as disabled in the HUD data. So to answer one of the other questions, we're using disability status as reported in the administrative data from HUD. They don't have to be on SSDI or disability income, but HUD has to have classified them as having a disability. So if you look at those lease-up rates, they actually nationally look very, very similar between households headed by somebody with a disability and those without. And to the extent there's any difference, it's slightly higher, but for those disabled, but it's very small. They look really the same. But we did a bunch of work about a year ago or 2 years ago where we were trying to dig into what drives success rates. And we were focused on a variety of demographics, actually a bit more on race and ethnicity. And we found it was similar also. The success rates were similar by lots of demographics when you look nationally. But as we saw, even within Massachusetts, households of different types tend to be in different markets and they face different housing challenges. And so when you control for market conditions, even down to the neighborhoods that voucher recipients are living in at the time that they start their search, if you control for those factors, we found racial and ethnic disparities, and specifically that voucher households whose head was Black had a 4 percentage point lower probability of getting to use their vouchers within 180 days. So controlling for other things, we found those differences. We found seniors were more likely. We found homeless were more likely. And then within that work, we did some analysis looking at disabled households, and we did find a significantly lower, but a much smaller difference with household heads with a disability. So we found this effect for Black household heads of 4 percentage points. The coefficients for these different demographics compared to those with a disability, the coefficient was about half the size. So it was significant. Controlling for everything, we did see lower lease-up rates, but we think a smaller effect than some of these other demographics.
Yeah, and I would just add in that, I mean, two quick things. One is that one thing we can't really observe, which may explain, for instance, the fact that we actually see these higher lease-up rates among people who are experiencing homelessness at the time that they receive their voucher, maybe just about the set of support services that they receive to help them find homes. Also for people who, some set of voucher recipients are given placements or offered placements and housing, and that's something we can't see it. And I will also just say that Kathy and I are in the process, sort of speaking about Jennifer, the next stage research. We're doing work in New York. We're just starting out where we're linking to, sorry for this is wonky, but we're linking to sort of state Medicaid records to see if different kinds of health conditions actually uh, make it more difficult for voucher recipients to use their vouchers. And we hope that that will, if we find something that might help in sort of targeting housing authorities and in targeting search assistance to households that have particular health conditions. And we can explore more the disability question there as well.
Yeah, this is just it's really interesting to hear all this and a reminder again that this is such a large program and there's so many things to think about with it. I'm going to turn to a few more things that people were asking in the Q&A, and there's just so many. One, and I think important to hear the two of you talk about this because it may be on a lot of folks' minds. On the length of time calculations, how much are the numbers really impacted by the fact that many voucher administrating agencies in Massachusetts have not been issuing vouchers or have had very limited ability to issue new vouchers in recent years?
Uh, yeah, I mean, Kathy, you should jump in. I mean, I think to some extent it also, these numbers also speak to exits though, and that's not going to be affected by
Mm,
the issuances. So, um, and we didn't look back in time, but it is possible that as if people are exiting the program at the same rate, but new folks aren't coming in to receive vouchers, then those numbers would grow. But I don't think, yeah, I think that these numbers wouldn't look that different if we had looked at them a few years ago. And we can
Yeah.
speak to that in New York where we've looked over time at
yeah,
different
yeah,
years. So Kathy,
yeah.
would you agree with that?
Yeah, it's interesting because their causation goes both ways, right? So to the extent that exits are down and people are staying in the program, that increases length of time on the program. And with that increased length of time on the program, we're not going to see as many issuances. So I tend to think of it as starting with that as the driver. But I think partially what Ingrid is saying, also one of the other reasons there may be fewer issuances is cost of housing's going up and you just can't afford more issuances. So that's a different driver. So I would say the first one is I tend to think of length on the program itself feeding back into the ability to serve more households. But there's another piece we haven't talked about, which is the cost of the program.
Great, thank you. So this is also related to another question, which is whether there's any information available, reliable information around the participants' reason for leaving the program.
Oh, that's so painful. And it's a pain point. I'm
Yeah,
sure for US practitioners and definitely for researchers. I
yeah,
know that HUD has added some emphasis for getting that information. But as I mean, a lot of exits occur in a version of disappearance, right? So they've
yeah.
left the program and the ability to actually get information about the drivers, making it very difficult to understand the difference between what are sometimes called positive and negative exits, right?
Yeah. All we can do is sort of look at the incomes the last time they certified. That's all. But
All right, thank you for that. I'm going to try a couple more. One thing, we've gotten quite a few questions that are just about the regional breakdowns and whether some of the things that we're seeing are because of the way that we combine geographies. And I guess I wanted to speak to that overall. For doing research like this, choices, of course, always have to be made. If you're going to be doing regions, what is the right or best way, really, because there's no right way that you can put together the different geographies of the state. If we get too granular, we really lose the ability to do some of the comparisons that you saw. If we get too big, we're really not delivering information that's useful at the more local level. So when we were thinking about how to kind of subdivide the state, first of all, we very much wanted to divide into regions, but we didn't want to get too small or too big. And we did try to group some regions to kind of complement other groups who are doing demographic research or other kinds of planning research. So the Western Massachusetts portion corresponds with the Western Massachusetts Housing Coalition's study region, and the eastern part of the state corresponds with the Greater Boston Housing Report Card. So that was some of our thinking. This will, unfortunately, there's no perfect way to do it, and I know from working in Massachusetts for a long time, there's, differing opinions about which communities belong where. We kind of did our best for this pass. We are not intending there was a question about releasing raw data. I want to make very clear that we only received analysis from the NYU team. This is data that is theirs under a data agreement. And so, no, we won't be sharing raw data. There is more that you'll be able to draw from the report and from the slides off the website, but we won't be giving people deeper data than that.
Yeah, and Jennifer, but I can jump in to just
Yeah,
say it's
please.
also sort of the more granular you get, also the more you risk, sort of undermining the confidentiality of the data, and we're under strict rules. These are restricted data. These are HUD administrative data, individual levels. So we have to aggregate to a certain level as well. And unfortunately, we are not at liberty to share the raw data. I will say that there is a tool on if I'm sure some of you know this, but I think it's still on the HUD website, the HUD user website, picture of subsidized households where you can get some PHA level and also some sort of neighborhood level aggregates of voucher use. So that you can't do everything that we've done here, but it can give you some big picture stats.
So another question we just got, given what has happened with SNAP and Medicaid changes, does the housing affordability gap take into account these non-housing programs that impact a household's income?
No. I mean, what we can just see is sort of the total cash income. We can't take into account these sort
Yeah.
of in-kind benefits and
Okay.
look at that gap.
Yeah. I would say I am prioritizing some of the questions that are more clarifications. We did not look at this, but we got a question that you may have seen from other research about if small area FMRs have affected utilization rates or perhaps mobility.
Take that,
Wow,
Kathy.
thank you for
Yeah,
asking.
yeah, we like that question.
Yeah, so we have a paper.
And that we can share.
We can share very much exactly looking at the impact of small area FMRs on both locational outcomes and lease up rates. So not PHA utilization budget, but actual lease up rates. And so that's really one of the big contributions. And I'll give the simple version and you highlight and Ingrid can jump in. So small area FMRs do appear to be effective on opening up a broader set of neighborhoods and lower poverty neighborhoods for voucher households. And that seems to be driven by families with kids. So I would call that maybe first top line. The second is that they do not appear to lower success rates. There was some concern that with the tilting of the payment standards, that the locations where payment standards would go down, which is where the majority of voucher households are leasing up in most locales, could drive actually lower success rates. We did not see that. There was no decrease in lease up rates. There was no increase overall in cost. And I would say the one set of households where we didn't see the locational, an increase in moving to lower poverty neighborhoods were seniors, which maybe is not surprising, not the most mobile and maybe not the highest priority in their choice of locations. Ingrid, today.
Yeah, no, that's a perfect summary. Yeah, I just say I think for the older adults, obviously they also may have sort of stronger reasons to actually prefer to stay in the communities where they are and not have this place the same priority on getting to neighborhoods with higher performing schools, et cetera.
Great. Well, thank you for that. And was this looking at New York City data or more national?
No, this is national, and we can. I don't know. Maybe Jennifer, we can send you a
Yeah,
link to the
that'd be great.
paper, and then you
Quite
can
a lot
share
of
it
people
out.
are asking about this, and it's
Yeah, and
certainly something we
specifically
wonder about.
all of the mandated areas
Right.
relative to the ones who almost were mandated or are more mandated now in the future. So we had comparison groups.
Terrific. So I think one just final, and unfortunately may not be an easy answer, but quite a few people are asking about just sort of the how disability ends up getting determined for the purposes of the calculations, given that it is
Yeah.
has a broad meaning in many different ways it gets defined.
Yeah. So we're really limited on this in terms of using what is in the data we are provided. So these are HUD administrative data. So it's uh, all of the households served in the administrative data. And so it's the way that the PHAs are coding that and what qualifies for that within HUD. And so there are some on the call who probably know better than I exactly what might go into that. And it could easily be that this is an understating of true disability status. I know we've seen some descriptives. Actually, Ingrid, you'll probably remember this more than me, where you can see that disability status increases over time for those who are on the HUD data, which may suggest they were actually disabled earlier, but at some point they're finally classified that way. So my gut is we're under capturing disability in the way that matters for functioning and ability to work, et cetera, but we can't see beyond the data classification.
Yeah.
So thank you for that. I'm going to have to close up this portion, which I'm very sorry to do because we have such a lot of good questions and suggestions for further research and advocacy and so on that we're just not going to get to today. Again, I appreciate everyone who submitted something. It may be things that we could report out on more later, and that's just incredibly helpful and certainly does um, show that we were asking some questions that mattered, and they have generated even more questions that matter. So thank you, everyone, and thank you very much, Kathy and Ingrid, for doing such a good job answering them and letting us know about some of the things that you've been studying that we can leverage. So I'm going to wrap things up here. We've got just a couple minutes left. Next slide. So really, I just now want to thank everyone. Particular thanks to Ingrid and Kathy and Jacob for your time and care in furnishing so much information and your thoughtfulness as well in describing it. Our work is also made possible by a gift from Howard Cohen and Myra Musicant that supports the Policy Action Center. Next slide. There are many partners that fund CHAPA that help make all of this possible. You'll see the platinum partners here. Next slide. Gold, silver, and bronze partners. And next slide. We also always appreciate your individual contributions and support. It does help make both research like this possible, as well as all the other things that CHAPA does. If you want to support CHAPA and grow your housing network and discuss these findings with dinner and your friends from the housing world, next slide. Please sign up for CHAPA's annual dinner, which is coming in June, and is always a great place to discuss housing issues as well as just enjoy being among others that care about these issues. So that is really all we have for today. Again, I couldn't thank all of you enough for supplying so many more questions to think about, and look forward to this really being, in effect, a beginning of more information on this topic, more information and findings that the center can bring to important questions, and really look forward to continuing to move forward the conversation about housing and stability and housing access in our Commonwealth. Thank you all.